Thank you, Wallace. I appreciate you doing that for me. And the other ways that you support us during webinars. So, to give you a little bit of background, I'd asked Kristina a few weeks ago, maybe, to provide information about Healthy Louisiana and Medicaid in lieu of open enrollment, which is coming up. It's super important for families and for those who support families to help make sure that they're aware of how important open enrollment is and the things that you need to consider when selecting insurance plans, especially when you're talking about families that have members with anybody really, but families that have members with disabilities. So she's going to cover some information for you. Feel free to put questions for her in the chat. We'll take care of those when she's finished presenting. Kristina is employed with what we call SWLAHEC. It's the Southwest Louisiana Area Health Education Center here in our area. So she's an expert. If you see her face, you might recognize her. She's out in the community a lot, helping families and helping professionals. So help me welcome her, please, from your computer screen where you are, and I will pass it off to you, Kristina. Thank you for being here.
Hey, thank you guys. Yes, so I am a certified navigator. Through SWLAHEC, our program is Navigators for a Healthy Louisiana. Our main goal is to just educate everybody and to assist people to know what their options are in qualifying for low cost or no cost health coverage. We do a little bit of both because we are federally funded. We do a lot. We can do the Medicaid or Marketplace. And so I'll go a little bit further into the PowerPoints and we'll discuss those a little bit more in depth. And yes, open enrollment is coming up. So open enrollment is coming up for Marketplace. As far as Medicaid, you can enroll in Medicaid any time of the year. However, you can only change your plan once a year. So changing your Medicaid provider, like if you're wanting to switch from, Louisiana Healthcare Connections to Aetna and all that kind of stuff, is now. So if that's something that you're needing, that's something you want to look into getting done as soon as possible, because that's coming up now. As far as open enrollment for Marketplace, that's going to be November 15th or January 15th. So, all right. So do I switch the slides or okay. So yeah, so just a little, okay. So I'll just give you like a little bit of an overview. We can skip that one. I kind of already talked about it. Okay, so next. Okay. Again, we are a nonprofit organization. We are federally funded through the U.S. Department of Health and Human Services for Medicaid and Medicare services. Some of the benefits of what I do, and like she was saying, you probably see me in the community a lot, is I am able to meet the people where they are. Other than going into someone's home, I can meet them at any public place that is convenient for them. If transportation is an issue, we can find a location that is closest to them and meet there. I've done applications outside of people's work. I've done them, I've met people at McDonald's and Burger King and coffee shops. So it does give us that flexibility to help everybody. Because again, if transportation is an issue, we can work around it. I can do applications over the phone. If you're farther away or whatever, if your work schedule isn't, going to help us get an appointment, we can do it over the phone on your lunch break or, things like that. We can go to the next one. We do have navigators in every region in Louisiana. In over 64 parishes. So if you have family members somewhere in Louisiana, let me know. We have navigators there that can assist anywhere. Okay, so let's see. So So we, like, again, that's one of the things about making a difference, is anybody's going to qualify for something, whether it's going to be Medicaid or a marketplace plan. If you don't already have health coverage through your job or something like that, you're going to qualify for one of them. Let's see. We do have interpretation lines. So like language barrier is not even an option to stop anymore. We have a way around it. We can communicate. I have gotten very cultured with different cultures, just enrolling everybody. I know the tricks and trades to, how that's going to work and who's going to qualify and what the criteria is to qualify. Let's see, you can skip that one. We'll skip the next one. This one, I mean, if anybody wants to look at it, this is just different ways and different organizations that we have assisted, and just they're good stories, in different ways that we help our organization. And but if y'all want to look at that, y'all can have this slide emailed to y'all. The next one. So we do work with a lot of organizations. I do sit specific places every week, but we also use different locations as just direct referrals. I have my card in the emergency rooms. So they're kind of like a direct referral location to where if somebody comes in, they can just get my contact information and call me, and I can set something up. Again, we do presentations for everybody, on-site enrollments. Let's see, wellness events. We do go out into the community a lot. Anytime anybody has any kind of wellness event, one of us tries to be there. Let's see, coalition meetings. Okay, we can skip that one. Statewide partnerships. So this is all the different locations that we currently work with statewide, not just region-wide. Okay, next one. Let's see. I tend to like to see when I'm working with somebody, whether I'm enrolling them into Medicaid or Marketplace. I do like to see what resources they need. I try to keep, work well with all the other resources in our area. And just kind of, see what they're looking for. If they need, if they need to go, for the Workforce Commission, like I'll give them their information. If I happen to, without asking too many personal questions, if we happen to, come across, oh, hey, look, they have a family member that could use, Family Helpings Family Services, I give them their information. If whatever contacts I've run across, I do try to provide them to everybody that could use them, because in a sense we are all still helping the same people. Everybody just needs a little bit of assistance. We can go to the next one. Okay. And again, your options for what we do, because it is a federal application that we're doing, it will tell me at the end of the application if you are going to qualify for a Marketplace plan or Medicaid plan. And then we go from there. If it's Marketplace, we can go into the application and just kind of look through all the plans that it's offering you. I like to just kind of explain how everything works and let you make your best decision. Medicaid, I always tell people, if you have Medicaid, we do the application, you get approved. Typically, it takes about a week to 2 weeks to get into the system. And then from there, I still have people who come back and see me, every couple of months. If they get something in the mail, they'll come back and see me. I can help them understand what Medicaid's asking for. Sometimes they're wanting proof of income. Sometimes they're just needing to know, if you are not working somewhere, they need like a termination letter or a resignation letter, whatever the case is. But I do assist even after I've enrolled people into Medicaid with whatever comes along the line. I have people come back and see me once a year with their eligibility documents they get from Medicaid, and we just kind of look over everything and make sure, everything is correct. And, I submit it all for them, and we're good for the until the next one. And again, I know we're kind of talking about the open enrollment and everything and wanting to change. If you see, I noticed some of the doctor's offices are changing some of their plans that they take. They're not taking anymore. I'm still kind of looking into, I've been hearing a lot about the children's clinic strictly taking nothing but Aetna come January. I'm still doing some digging into that to better understand if that's the case, and what we need to do. If you are finding this is something that they're telling you, you can always come see me. You do not have to change your doctor necessarily. You may just have to change your plan. And I can email it, or you can contact me and I can get you some copies. I do have lists of all the Medicaid plans that are offered in our area, and then lists of what they're offering. So if you're not sure what you want to go with, you can at least look and see, what they're offering for the different plans. But you do not have to change your doctor. You just have to change your plans. And that is something that you can see me and I can help you with. Next slide. Okay. So these are just some of the qualifications for Medicaid. Low income, anybody under the age of 19 is going to qualify, unless their parents' income is significantly high. And the cutoff for the LA CHIP program is significantly higher than the cutoff for just regular Medicaid. Pregnant women are going to qualify. Even if you have health insurance already, sometimes I'm noticing some of the health insurance that you have through your job or through your husband's job or whatever the case is, it may not cover pregnancy. So in that situation, you still could qualify for the LA Moms program, and at least your pregnancy is covered through Medicaid. Let's see. Other qualifications. If you are on any kind of Social Security, if you're over 65, or if it's for the Social Security disability, whatever the case is, if your income is low enough, you can qualify for both. You will have Medicaid and you will have Medicare. And when you have those, what is going to happen, again, if your income is low enough, the Medicaid will pick up everything that your Medicare is not covering. So that would be all of your copays, all of your prescriptions, things like that, doctor visits, anything that you would have that would come out of pocket that your Medicare is not covering, Medicaid is supposed to pick up. There is, again, it is an income limit. So if your income is over that limit, then you would have like partial benefits where your Medicaid would only cover certain things, and you may still have a little bit of copays coming out of pocket, or whatever. Some of your prescriptions may not be fully covered. You may still have to, pay $5, $10 for some. Next slide. So this is just a little bit of a income eligibility. I do like to give this to everyone. Again, this is for adults, because like I said, the LA CHIP version is a lot higher for the cutoff for the kids than it is for the adults. So this kind of just shows you household size and income, just so like when you're going into it, you can look and see and make sure that you would qualify. And then if you do not qualify for the Medicaid, that is when the marketplace comes into play, and we can get you a tax credit and at least have you some health coverage. Next slide. Okay, and this is the one, like I said, this is the one for the kids. It does break down, if anybody needs this, it does break down the LA CHIP program for kids, And then it also has the LA Moms program. So you can, again, even if you already have health insurance and you're pregnant and you notice that your health insurance is not covering your pregnancy, you can look at this and say, oh, okay, well, we can still qualify and at least have some help with that. Next. Okay, so this one is new. I'm not entirely sure how this one's working. It doesn't really make a lot of sense to me, but I'm still kind of trying to figure out the kinks. They are saying they're going to start checking wages for Medicaid every 3 months. I'm not sure how that's going to work, seeing how typically it can go off of your yearly income, because that one really goes into play for the people who own their own businesses. You know, if you have a business that is seasonal, you know, you may be doing really good in the summertime and not really good in the wintertime. And so I'm still trying to figure out how Medicaid is supposed to take that into consideration, because nobody wants to be enrolled for 2 months and then not qualify for 3 months and then qualify again and have to, you know, back and forth of applying. So again, that one, we're still trying to get Medicaid to clarify everything with that. Next. So some of the things that you can do if you already have Medicaid, the most important thing that you want to do is make sure that your address is and your email address and phone number is always up to date. If you move, you want to change it. That literally, if you need to change or update anything like that, you can let me know. It takes 3 minutes to log in and to update your information. But if you're not up to date with your information, then this next part, when they start sending you letters, you're not going to receive them. And you want to make sure any letter that you get from Medicaid, you're responding to, whether it's, you know, whether they're asking for proof of income or whether they're asking for proof that your household size has not changed, or even if it's just a renewal letter, because they do send out renewal letters once a year. And when you get the renewal letter, it's as simple as checking all the information on the pages and signing it and mailing it back. And again, I am able to help somebody with that if they need help with that, or anything else. But it's a matter of doing it in the time frame that they give you, because if you do not respond, they will just kick you out. And again, we want to make sure that nobody gets unenrolled unnecessarily. Sorry, I lost my place. Okay, we can go to the next slide. Okay. Marketplace plans. Again, marketplace plans is the Affordable Care Act. It kind of helps that middle where you don't have coverage, health or Medicaid, because your income is too high, but at the same time, you're not going to be able to afford $600-700 a month for a health plan. So it gives you that tax credit. I know you guys have probably seen the commercials on TV about it. It does. I like to tell people I range it from $0 to like $100. It is based off of your income. The higher your income is, the less of a tax credit you're going to get. So I don't want to tell people, oh, hey, you're going to get a $0 plan or you're going to get a $10 plan. Yes, I do see those, and yes, that does happen. But based off of your needs, you may not want that $10 plan anyways. You may want, you know, the $50 plan, or you may want, you know, whatever best fits your needs. Because with the marketplace, we can make sure that your doctors are covered under the plan that you're wanting. We can make sure that, you know, if you have certain prescriptions, that we put those in so that it'll let us know if those are covered under it. There's so many different like variables and ways to make sure that this plan that we're looking for is going to be as specific to you as possible. So everything's a little bit different than that, but you know, so they all go to the next one. I'll do that. So the good thing about the the Marketplace and the Affordable Care Act is when they put this into play, every health plan that is offered through the Marketplace has to meet these 10 essential health benefits. You have to be able to go to all your preventative services, and it has to be covered. So even if you have copays with the plan that you pick, your preventative services are going to be covered under your plan. Lab services, and then of course this, with all this, it took out people who had pre-existing conditions. Now they have to be approved for health coverage. They can't be denied based off of their pre-existing condition. So this really did benefit, the health industry. Next. So this one kind of just talks about like who would qualify for Marketplace plan. And this kind of goes for Medicaid a little bit as well, and Medicare. You have to be, one second. You have to be a lawfully present in the United States to qualify. For Medicaid, you have to be lawfully present for 5 years to qualify for Medicaid, unless you are under 17 or unless you are pregnant. But for Marketplace, you don't have to be you don't have to have full citizenship. You just have to have a work visa. You have to be working and paying income tax. If you're not fully processed to where you're at least able to, work and have a work visa and pay income tax, then you wouldn't qualify. And of course, for Marketplace, you cannot have a Marketplace plan and have a Medicare plan. You cannot have a Marketplace plan and have health insurance through your job. You can get a Marketplace plan without paying income tax, but you won't get a tax credit. So your plans will be much higher. Next. So other than November 15th through January 15th, which is open enrollment. I'm sorry, November 1st through January 15th, which is open enrollment. The only other times of the year to qualify for and to be able to get into a health plan, and this is Marketplace, but this also, it's very important to know if you have health insurance through your jobs and things like that, this is still the time to be able to change and adjust any of those plans. If you want to get into it, any other time of the year, it has to be a life event. So if you've lost health coverage, that's considered a life event, and they give you a 60-day window to get in. If you've gotten married and so you need to add your spouse, and that's a life event. If you have babies, see if you are no longer eligible for Medicaid, and this is a pretty big one. So if you find out, especially last year while they were doing that unwind and checking everybody's eligibility for Medicaid, if you get unenrolled from Medicaid at any point of the year because your income goes up, you have 60 days to get into a plan somewhere else, whether that's the Marketplace or again through your job or whatever the case is. You have that little time frame because that is considered a life event. Next. So this one just basically talks about the direct referrals, which I'm not going to go too deep into that because you guys kind of already are a direct referral for me. If anybody else wants to be a direct referral, again, I am able to bring information, set them up at your locations or whatever the case is, and maintain them, always changing them if things are updated, just so that whoever your consumers will have access and know how to find us. Next one. Let's see. That's just, I think, okay. Next one. These are our little referral cards. These are one of the things I'm able to set up at any location. These little QR codes that you see on there, it takes literally they timed it. It takes 1 minute to scan that QR code, put in your information, and it will send your information directly to the navigators. And we will be able to call you to set up an appointment. And that is, again, if you have any questions, even if it's just a question, if for Medicaid, or you got something that you're not sure what to do with, you can scan this code, and you can give us a call. We'll call you back as soon as we get your information and set up a time to meet up, or just talk over the phone if that's best for you. Next. These are our flyers. We do have up-to-date ones that I would put into, give out into the locations and things like that. The new ones have the new charts. So these are, if you look on here, these are for 2003. I do have the 2004 ones that I actually place around town and hand out. Let's see, and then next. This is just information. If you guys, ever want to be a part of the newsletter or follow our Facebook page, we do like to keep information that's going on with the health industry. If things are changing, they will post it on Facebook just to kind of give everybody that heads up. But those are some links. Next. I think these are just next. You can skip that one. That's just if anybody does want to be a direct referral, I mean, you are more than welcome to reach out. Okay. You can skip that one too, yeah. And then that's just my contact information. You can get me directly, or like I said, I know I tend to like to talk to people in person, but if it's something we need to do over the phone, if anybody has any questions, they're more than welcome to call my cell phone. If I don't answer, I don't like to answer when I'm in an enrollment. You can text me, or you can just leave me a voicemail, and I will get back to you as soon as I'm done. But yeah, that's pretty much it. I'm not sure. Let's see, we have any questions? I don't see any questions. I don't know if I'm missing any.
No, I don't see any either. Now is your opportunity, guys. If you have a question, go ahead and put that in the chat for me.
Do you have any questions? Like, did I miss any of the little main points
No?
that you were, because I know you were talking, we wanted to talk good bit about Medicaid.
Right.
I did, like I said, I did want them to understand that Medicaid does not technically have an open enrollment. It is any time of the year.
Yeah, I
but
think I used the wrong terminology. This would be the time of the year to change plans, which you clarified. I
Yes.
appreciate.
Yeah.
Yeah. So
And
not open
again,
enrollment as much as
I don't know how many kids you guys deal with and families, but I am hearing a lot from people that I have been working with about the children's clinic leaving Louisiana Healthcare Connections.
Yeah.
And strictly going to nothing but Aetna.
Yeah. I've seen that since you and I spoke. I saw a post about it again. So
yeah. And so like I'm trying to help, like, I guess, help them not stress out so much, because they're like, oh no, now we have to go find another doctor. And I'm like, well, not necessarily. You have options. You can look into other plans. If you, again, with Aetna, it's either Aetna or finding another doctor if that's the case. But I have those charts to where if somebody does want to look into it to see if the other services will best fit them, they have options.
Right. So what I would say to our attendees is, it sounds like Kristina would be an incredible resource to you if you need to look at the benefits of the Healthy Louisiana plans. I can't speak for her, but I know at Families Helping Families, we can't tell you what to do. We won't be encouraging you to pick a specific plan, but we might be able to help you ask questions of your situation to be able to find the better fit. Because the reality is that if your child has a special health care need or disability, and your specialist does not take Aetna, but your pediatrician does, then you're going to need to ask yourself some questions and dig into the best decision for for your family, for your child and your family.
It's-
And that might
and
not be easy, but there are things to look at and consider when making those decisions.
and if you do happen to come across people like that, please let me know, because I'm in the process of trying to figure out why, because that's very limited.
Yeah,
I mean, sticking to just one plan, I mean, there's 6 different plans. Like, none, you literally are only going to be able to have that one plan to go to that one location.
right.
I've heard of doctors not taking one or two, but I've never heard of them only taking one specific one. So like I said, I am trying to get in contact with Aetna to see why, and also with the pediatric center, and trying to figure out if it's something, what the reasoning is. And in those situations where, okay, well, this kid or this person goes to the children's clinic for certain things, but their specialists don't take Aetna. That's what I want to be able to tell them. Okay, well, what
Right.
are you going to do in this situation? Like, I'm 100%, I tell people all the time, I do not work for Medicaid.
Right, right.
So I am not scared to call them and ask, why are you doing this? Like, tell me
Help
how
us
this makes sense.
understand. Yeah.
Right.
Yeah.
Um,
And that's where I think where you want to help and where we want to help as
yes,
a resource center is just make sure that families are prepared for the changes and
exactly.
because you're locked in once you select unless you have a
Exactly.
life-changing event. And so
Yeah.
what you don't want is not to have access to very important care. And they're very early on when the managed care plans came into existence, there was only the one plan that one of the pediatric offices in the area took. They took legacy Medicaid, and then they also took one specific plan. And there are reasons for those kinds of things. What I want is to make sure that families can still access care and prioritize what's most important. And so we just want to make sure we're educating families, at least here at Families Helping Families, and helping them ask the right questions to make the right decisions. So,
Exactly.
um,
And
and I
and
know
again,
that's your heart too.
yes, and again, I mean, even if you just have a simple, or you think, oh, well, I don't want to call her because this is just a silly question, I will answer it. I will, if I
Yes,
don't know
call
it,
or
I will
text her.
research it.
Call or text her.
Yes.
Yes, for sure.
I see people all day long, and some of it breaks my heart because I'm like, I don't know how much more I can do.
Yeah,
That's why I like to have all the other resources, so that I can be like, well, I can't do this, but I can send you to who can.
right.
If
Yeah.
I can't find you the answer, I'm going to find who can give you the answer.
Yes,
So,
of course. Of course.
I have a Medicare question. Like, if you have original Medicare, you know how they don't cover the other 20%? Is there
mhm.
help to find to cover the 20% that the original Medicare doesn't cover?
um, so again, that's one of those that I could send you an independent Medicare rep to ask that better, because I don't really deal with the Medicare side. I do know there's like the Medicare dual plans, there's savings plans, things like that. And it is income based also. So if your income is over a certain limit, I know you can't get where Medicaid covers everything, but you can maybe get a savings plan. But I can send you an email if you would like, Mr. Wallace, of some contacts for independent reps. Again,
Oh, please. Yeah,
I
in
like
case
to use
somebody needs that.
yeah, I like to do the independent ones because, like you were saying, I don't want to push anybody towards a specific plan. So if they're independent reps, then they're not going to be like, oh, hey, come sign up for this one. They're just going to kind of like help you in general.
Right.
So
Guys, please again ask your questions if there's something that you have or are curious about. I want to draw your attention to the chat. Wallace has put the post evaluation survey in there. If you'll fill that out for us, we need your input. We need to know if this was useful to you. We need to know what else might be useful to you. I would also say you're going to get an email after this presentation is complete. We're going to provide the resources that Kristina provided to us to you, and then we'll put the evaluation survey link in that email as well, just in case you missed it when the webinar closes. And then you could provide any other questions or feedback that you have in there as well. But I know that Kristina values the input, and so do we. So you still have a few minutes to ask questions if you have any. Okay, here we go. We've got one. Can you explain the difference? Do you see it?
Yes. I will have to do a little bit of research on that one. I did write down her name to see. I'm not really sure what the legacy Medicaid,
So
what the difference
legacy
is.
Medicaid is original Medicaid, old school Medicaid, where it
Okay.
wasn't a private insurance plan that actually delivers the services. When Medicaid managed care originally came to be, you could actually elect to stay with legacy Medicaid or traditional Medicaid. And
Okay.
then as things changed, there was only a certain population of individuals who could continue to have legacy Medicaid.
Kind of grandfathered
Like
in type.
Kristina, I'm not sure how much of that has changed and how recently. I'm willing to do the work, Kristina, unless you find
Right.
something sooner. But
Right.
yes, legacy Medicaid is OG Medicaid, Medicaid
Okay.
as it was prior to Medicaid expansion, or not Medicaid
Okay.
expansion, excuse me, Healthy Louisiana. That's had like
Yeah.
3 different
Yeah.
names since it was implemented. So that
Mhm.
the current terminology is Healthy Louisiana, but it's
Yeah.
changed over the years.
Okay.
That's legacy Medicaid.
So, and so with legacy Medicaid, I mean, again, you would have to be grandfathered in. So, uh, it's not
You
like
just
we
have to
could
qualify for
enroll.
Medicaid. So what
Yeah.
it is that
Yeah.
there at one time, um, you had to be part of a particular group of people to be able to continue to have legacy Medicaid.
Okay.
Chisholm class. I don't know if that sounds familiar to you. It's
Mhm.
complicated-ish, but that's it, Miss Gina. And I
Yeah.
can, like Kristina, try to send more information, but that is
Yeah.
what legacy Medicaid means. And I apologize
Yeah.
because it's had a couple of different terms. It's been called a
Yeah. And
couple of
no,
different
and
things
that's fine.
here.
Um, Again, I've only been doing this for about 2.5 years, so I was
And
like,
it's
I'm
changed
really
since
not
then.
sure what legacy Medicaid is, but I will definitely look into it. And again, I would think if it, like you were saying, if it was the original one, I would think I would, the only difference may have more benefits because it was, but I would think if any new benefits, I would think they would automatically get them because it's changed, you know? Like I would think any of the new things that's going on with Medicaid is automatically under it. I would just want to look and see if there's things that if I'm enrolling people in a Medicaid today aren't qualifying for because they don't get that plan, you know? Like, so
Yeah,
I'll definitely look and see if there's different benefits to keeping that, but I don't know. I'll look into it.
sounds good. We can definitely follow up, Miss Gina, if that didn't adequately answer your question, but that's
Yeah.
that's legacy Medicaid. Okay, guys. We still have a few minutes. We'll be here for a little bit. If you think of anything else, please let us know. You'll receive that email here within the next hour or two. That's my fuzzy coworkers in the background, y'all. I'm so sorry. Just let us know if you have any other questions. We'll get these resources out to you as quickly as we can. Kristina, thank you for providing your
Oh yeah.
expertise. We appreciate it, and for
Yes,
providing the
ma'am.
resources. We'll get those out to participants. And if you'll just fill out our survey, scroll back up through the comments, grab those links if you need them that Wallace has put in there so generously. And I think that's it content wise. Thank you all for attending. We'll be here for just a couple more minutes if you have any other questions.